Infection control. Keep the amounts of jewelry you wear to a minimum. In order to reduce the places germs can hide, do not wear bracelets and bangles. Limit the number of rings you wear to a simple wedding band. Jewelry can hold germs that you can take from client to client, possibly causing them to be sick. Sharp edges on jewelry can cause small tears in gloves that will decrease the protection provided by the gloves. Clean hands are very important for the health of the clients you are caring for, as well as you and your family's health. Hand washing and use of alcohol-based hand rubs is referred to as hand hygiene. To keep clients safe and to protect yourself and your family, do not ever skip hand hygiene. Hand hygiene techniques will be discussed and you will be expected to return demonstration using both methods. Hand washing is the single most effective way of not spreading germs from one client to another. The CDC estimates that each year nearly 2 million patients in the United States gets an infection in hospitals, and about 90,000 of these patients die as a result of their infection. As a medication aid, you will come in contact with many different clients that you do not want to make sick or sicker, including yourself. In order to do this, you must be especially good about keeping your hands clean. People who work in healthcare settings give the following reasons for not washing their hands, as reported by the CDC, saying that hand washing makes their hands dry or irritated. Sinks are not easy to get to or are not stocked with paper towels and soap. There is not enough time. However, clean hands are one of the most important things you can do to protect the clients you are caring for and yourself. So it is very important that you figure out a way to wash your hands or disinfect them prior to contact with clients, and make that a part of your medication administration routine. The CDC defines the different ways to clean your hands as: hand washing refers to washing hands with plain soap and water. Antiseptic hand wash refers to washing hands with soap and water or other detergents containing antiseptic agents. Alcohol-based hand rub refers to alcohol-containing preparation applied to the hands to reduce the number of viable microorganisms. Infection control. Hand washing with soap and water is the best way to clean your hands for people who are working in healthcare settings. The CDC recommends healthcare workers wash their hands with soap and water when their hands are visibly dirty, contaminated, or soiled, and to use an alcohol-based hand rub when their hands are not visibly soiled to reduce the number of germs on the hands. The CDC reports that although plain soap is good at decreasing germs, antimicrobial soap or antibacterial soap that reduces the number of bacteria on the hands, is better, and the alcohol-based hand rubs are the best. Research has found that alcohol-based hand rubs were less drying to the skin and also took less time. Module hand hygiene. Objectives. At the completion of this module, the learner should be able to understand the importance of hand hygiene, demonstrate hand washing technique, demonstrate alcohol-based hand rub technique, demonstrate the proper way of putting on and taking off clean gloves. Procedures. Clean your hands. When you arrive at your workplace, prior to beginning any task, including medication administration, before and after every client contact, after removing gloves, before and after eating, after using the toilet, before leaving the workplace. Wash your hands with soap and water prior to administering medications. You may find it easier to clean your hands with an alcohol-based solution between clients to whom you are giving medications. To make it easier to clean your hands, you may place an alcohol-based hand rub solution on your medication cart or at the site that medications are administered. Note, some agencies do not allow alcohol-based solutions due to the fire codes. Some of these agencies use hand wipes between clients instead. It is important to be conscious about hand hygiene. It is always important to follow your agency's policies regarding all aspects of medication administration. Key point: you should wash your hands with soap and water anytime your hands are visibly soiled, contaminated, or dirty.